Big room today. My name is Matt Stucky. I'm the data governance lead for the Department of Health. And thank you for joining us. We are going to walk through minimum viable governance and really how we can balance control with agility. One of the big problems with governance itself is a lot of people talk about too much control. Our focus today is really to show you how to break down those policies a little bit to make things a little bit more free for your staff to do their work. With me today is Chris Schilling with MPH, and together we'll bring both an IDOH perspective and a statewide perspective to governance. We'll cover core content for about 25 minutes and hopefully have a lot of time left for questions and answers. Next slide. From there, before we dive into the mechanics of governance, IDOH likes us to promote our mission and vision. Our mission is to promote, protect, and improve the health and safety of all Hoosiers. And at the same time, our vision is that every Hoosier reaches optimal health regardless of where they live, learn, work, or play. And we find governance is a big piece of this in order to both have safe data that we collect and make sure it's secure and allows better analysis throughout. Governance supports this and ensures consistency, safety, and trust. The main learning objectives for today, we're hoping to help you understand the concept of minimal viable governance, learn the core principles and framework for MVG, explore practical examples and benefits, and then we'll review some areas where we have implemented MVG at IDOH. And if the acronyms are too much, just yell at me. We only have a couple in here, really. I think MPH, IDOH, and MVG, mostly because I don't want to say minimum viable governance 20 times or 50. So good governance, really, I'm sorry, go back a second. Let's start with, does anybody know what governance actually means? Or can somebody give a quick example of governance in their area? And there's a little bit of interaction in this, so. Yes.
Giving, like, setting rules and expectations for the behavior of individuals.
Right, that's a big piece of it. Policies and procedures is a lot of times used to kind of respond to that. Okay, you can switch now. So governance really are those rules and processes that enable the work. Really, what it is it ensures people know what's expected of them. When governance is done right, it creates alignment, reduces confusion. Teams can focus on execution and not guesswork. Really, the focus with governance is that it's a system of decisions, rights, rules, controls, and processes that ensure that work is done safely, consistently, and compliantly. But as we'll kind of get into, we want to focus on where those rules become too tight and too strict for your staff to do their jobs. Another show of hands real quick. How many of you have ever encountered a policy that slowed you more than it helped you? Okay. So a good part of the room. So that's a big piece of why I'm hoping that you're all here today. Okay, we can move on to slide. And that really is the tension that MVG helps to address. Now that we've established what governance is, we want to kind of look at talking about minimum viable governance and why it matters. MVG helps us find the smallest set of governance controls required to manage risk effectively. Too much governance slows projects down. Too little creates a lot of risk. MVG provides enough structure for safety, compliance while enabling speed. What it allows is for your staff to still do their jobs without and understand what the rules are, but not be held down by so many rules that they can't just do what they need to do to complete their job. It's really about being intentional, not only what adds value, but or really keeping only what adds value to the policy itself. Getting into the standard operating procedures, we'll also kind of start looking at where those can be balanced as well, so that you're setting up rules and then steps, but the steps aren't so strict that somebody who does things slightly different because of the way the work that they do is different from the person next to them has done, can help them both do the same procedures, but still allow for that balance of how they need to do their job. So one big example is a dashboard launched without governance has exposed sensitive data. Part of the reason that the dashboard exposed that data was there were no governance policies specific to the tech side of things. So there wasn't classification, there wasn't tagging done on the inside. So an MVG policy was created to help with that tagging to make sure that any staff who at least knew that what they should and shouldn't do still couldn't do some of those things. Automating the process is a big piece of minimum viable governance as well. So another example I have is kind of a beehive example. So bees, they go out and collect pollen from flowers. I'm a big fan of Gary Larson, The Far Side. He anthropomorphizes in most of his comic strips. So thinking of bees and how they have their rules in their minimum viable governance, in my mind, they're set to go out and know they can't touch milkweed or something like that. Certain plants that they're just not allowed to have. Those are the risks that should be in the policy. Otherwise, they're not told, hey, you can only collect from daisies in the fall. Well, daisies in the fall is a problem because they're not growing in the fall. So the way this is set up is with bees, they're told to go out and collect pollen. And bees tend to collect from the same flower. Once they find the flower that actually has pollen on it, they'll continue to move on at least 50% of the time. They tend to move on to the same flower because they know that that flower is going to have pollen at that time of the year. They're not told, hey, you can only collect from that flower though, and that's why it's only about 50% because they will find other flowers along the way. So in a minimum viable governance example with that, it's really, they're told go out and collect pollen, but avoid these things because that could kill us, the whole colony. So so really, how do we do this? And this is where Chris takes over. So he'll help kind of go into the framework and kind of explain how you guys think.
All right, how you guys doing? Doing all right? Good. All right, so MVG relies on three simple but powerful components: policies, standards, and SOPs. As far as policy goes, that's what must be done. Standards is how we measure it, and SOPs is how we actually execute it. So keeping these separate gives us agility, policies stay stable, and SOPs with tools and needs. Overall, the four core principles of minimal viable governance is a risk-based approach, iterative improvement, collaboration, and automation where possible. So what does that mean? So the risk-based approach, legal and financial risk must be addressed, of course. The iterative improvement, the policy should be making changes that can be done by your organization. And collaboration, that's a big thing, especially I know John mentioned DCAM. If any of you have met me with going over DCAM, I always reiterate communication. Teamwork makes the dream work. So those MVG policies, standards, and SOPs must have involvement and buy-in from different teams that are actually affected by it. And so with that automation, in order to stave off overwork brought in by new policy and SOPs, MVG focuses on looking for areas to automate those processes. All right, I'm looking for some audience participation here. So of the MVG principles, which do you think would make your job easier? Risk-based decision, collaboration, iteration, or automation? You can raise your hand. Automation? All right, right on. Go ahead. So we've already seen MVG work across state agencies, whether that be simplifying data tagging, streamlining reporting workflows, and reducing approval bottlenecks. So I wanted to give an example as far as like whenever I stumbled upon this concept, when I was creating the AI readiness assessment methodology, try saying that 10 times fast, and the AI risk assessment, there were a ton of controls that were possible, and I had no idea where to start. But by following the MVG framework, I was able to implement minimal controls by starting with the top risks. My goal was to identify the smallest set of controls that meaningfully reduce risk without slowing work. This is why a risk-based review process replaces long approval chains. So you have same safety, but a faster path. So you may ask, so how do we even measure whether it's working or not? So there are 3 questions that you can ask yourself. So first one being speed. Are projects moving faster? Second one being compliance. Are teams following the simplified rules more consistently? And adoption. Are staff actually using the policy because it's shorter or clearer? At that point, we can revisit these throughout the year and verify what's improving, and if friction still exists. When governance aligns with how people actually work, compliance flows naturally. Slide, please. So, get to the benefits. And this is what we actually gain when we simplify and right-size our policies and processes. So, first one being faster project delivery. When we reduce unnecessary approvals and streamline governance, work moves at the pace it needs to. We have a great real-world example on this slide, a data integration project that launched 6 weeks earlier, simply because the approval process went from 20 approvals to 1 risk-based review. So minimal viable governance doesn't necessarily cut corners, it cuts noise. The second one being is a reduced compliance risk. So that might also seem counterintuitive, but simpler governance is easier to follow, less invasive, and also you'll have at the same time invisible governance, because governance should be, in the back end, not always in your face, constantly stopping you at every single point. MVG makes it easier for teams to understand what's required and which leads to stronger compliance. And lastly, you'll have easier stakeholder buy-in. Lengthy or over-technical policies kind of tend to lose people. Short, clear, and focused governance increases adoption. And when governance is approachable, people engage with it, and when they engage, they actually follow it. So benefits of MVG reinforce each other by having faster delivery, lower risk, and higher adoption. And that's the power of a simpler, more intentional governance model. So how do we actually get it going? Where do we start? Start out with a few practical steps. So these are the steps that program can take, no matter how large or complex it can be. So step 1, identify your top 3 risks, because if you try to tackle a problem or try and implement a policy with 20, 40 different things, people are going to be like, oh, where do I even start? By focusing on just your top 3, you have to start with what matters most. And so you ask yourself, what issues create the most confusion? Where are you most exposed? Where does misalignment cause the biggest problems? This is a good place to involve your legal teams and privacy officer. Step 2, define the minimum controls needed to manage those risks. Not the ideal controls, but comprehensive. The minimum viable controls are the ones that meaningfully reduce risk without introducing heavy process overhead. Thirdly, communicate clearly. You're going to get tired of me saying teamwork makes the dream work by the end of this, but even the best governance fails when the message is unclear. MVG prioritizes simplicity. So when you communicate, keep it in plain language, concise, and actionable. And finally, we iterate quarterly. MVG is intentionally lightweight so we can adjust quickly. Instead of rewriting entire policies, we revisit our controls and SOPs regularly and update them based on what we've learned. This slide is all about action. These steps are simple, repeatable, and designed to meet teams where they are while building the governance muscle over time.
I'll start with standards. Where should they live? A big question that tends to come up with a lot of governance just governance talks is KPIs. How do you create them? Where should they live? Do they go into the policy? Do they go into the SOP? Should they be on their own? And early on, when you're starting your governance across your agency or organization, a lot of them are put into the policies directly. That helps everyone on the early end to say, okay, here's the rules, here's my guidelines, this is what needs to be done. It also gives everyone the same document across the agency to look at. But as I kind of had said earlier, well, I'll just ask now. I don't think I specifically asked. How many of you have opened a policy that's 30 pages long and just closed it because you just didn't really have the time to look at it or didn't want to? Right. So that's kind of the issue with a lot of governance policies, is that they start off all in one place, specifically so you can find things. And so all the information's in one place. But as you go into it, as you mature your system, you find it's harder to update when there's changes. One of the big issues with KPIs is that generally a lot of KPIs are built before a lot of baseline data is even collected. They have an idea in their head of, hey, we believe this person should be able to do this much over this amount of time. Putting that into a policy makes it very difficult when the reality hits and that's no longer possible, or just never was possible to begin with. As Chris said, teamwork makes the dream work. When building up governance policies, work with the people actually that will be doing these things. One of the examples that I have for standards really is, or going back to the beehive example, I guess, you don't know exactly what flowers are going to be in a flower patch. You can say, okay, you need to collect from these flowers this month, but let's say somebody threw out some seeds all of a sudden that are not from the area. You've got new flowers. And so adding that into the policy is going to take time to change that when new flowers arrive. One of the big pieces for policies is they take a lot of work and time to reapprove, to redo, to go through the chain of command of this person needs to look at it and review it, that person needs to look at it and review it, and eventually it gets approved at the highest level and gets spread out. Doing that every time a KPI changes, or every time something in just workflow changes or federal rules change, becomes a problem. That's where it becomes harder to update. And this is really where the standards, you start to look and say, okay, now that we've kind of gotten to the point of seeing how data actually flows, how can we change those standards to not be in the policies and maybe not even in the SOPs? So we start to look at, and sorry, another acronym with SOP is standard operating procedures. But really we want to see where is it that we should put them. And a good example that we use, and I'll get into this a little bit more later, is we're working on centralizing our data request process within the Department of Health. Right now, we've got over 40 divisions that have multiple program areas. They receive data requests from all sorts of places in many different ways. Some are emails, some are phone calls, some have their own forms, some have Excel that they just document. Some don't document anywhere. They get a phone call, they see if the data is okay to send, and they send it. It's never documented. So one of the things that we are trying to do is set up that policy across the board for everyone. And when we first made the policy, or when the division made that policy, it ended up being over 30 pages. And we'll talk about that a little bit more in a second. But 30 pages of 5 different policies all blended into one, with so many restrictions that nobody was really sure what they should or shouldn't do anymore. And so we started building out a KPI dashboard to show, okay, again, we expected them to, if it's just a request off the street for public information, we don't have a dashboard for it, we can get it done in 5 days. We didn't talk to all of the divisions to say, is this reality for your specific program? In some programs it is, other programs the data is, they're asking for something from 10 years ago where something has changed, legacy systems had changed and they've moved on. So it's going to take them weeks potentially to produce this, because they have to go back. The person who originally built that old legacy system is gone. how that data was pulled is the information is gone. So it's going to take some time to figure that out. And so we found that by building the KPI dashboard and not having baseline data, we had to go back through and change those policies and really kind of pull that information out because we didn't know what was going to be possible. And we had to kind of start fresh from the beginning when we did that. Another example here, encryption standards embedded in policy worked early, but later needed separated for flexibility. A lot of the issues with the encryption standard is languages change or something else is going on. So building those into a policy or an SOP, policies more so, they take a long time to get redone and get reapproved. With an SOP, those are a little bit simpler to switch things out on, but the standards really should have their own dashboard. They should have their own place that ends up being separate. But again, you mature from the early stage down to where you want to be in the end by going slow. The iterative steps, as Chris mentioned, are extremely important to slowly build those out one step at a time. So two of our examples, like I started talking about with the data sharing policy, we reduced the original policy. We had 5 different policies that were really focused on the different types of requests that we received. We said, okay, local health departments request data that is their own data, but they don't have access to it because they send it to us and they don't collect it in the same way, and we have a better way to get it back to them. So it's going to be different from an external research that wants health data to work on a research project because it's not their data. So we thought, well, we need a separate policy for that. Then we looked at, well, we get random requests for data from people on the, let's say, Regent Street Institute. You know, they do a lot of research, but they're not necessarily going to have an IRB approval because of what they're doing. It's not the same type of research. We also looked at internal internal requests between different programs within IDOH. We thought, well, that's going to be simpler because in general, we have an overall system for requesting and sharing data internally. The problem that we ended up finding out though, is when you build a 30-page policy, again, people don't look at it, and it becomes too complex and too confusing, and too many rules get into it. So we ended up looking at everything and seeing, well, what we really needed was just these simple risks. You know, don't share data that's federally restricted to share. Don't share data that's got PHI or PII in it that we can't unless we have the proper data sharing agreements. So we were able to move that 30-page, 5 different combined policy into a 2-page policy and really a 4-page SOP. From start to finish, the sharing goes from, you know, the request comes in, it gets to the right program area, which before sometimes we'd get a call for a request. I'll say immunization would get a call for a request for cancer data. Immunization didn't realize it was a cancer request, and instead of forwarding it to the cancer person, it would just sit there. Either the phone call would be forgotten about, 2 weeks later, the person might call again, they might not. And then we get to 6 months later and they're trying to figure out, well, why didn't I ever get a call back? It's a big reason that we wanted to centralize this process, but we moved through the system step by step, and that's what the SOP allows for. It doesn't restrict certain things outside of those legal restrictions we have, but that's how we were able to move it down to 2-page policy and a 4-page SOP. The co-pilot policy was a little bit different. So when they told us that we were going to be getting co-pilot across the state, sometime in the fall, you know, there was a pilot system from September through December, and then they started rolling it out, February maybe, I think, across the state. And we were basically given 2 weeks to come up with a policy. So our chief information officer at the IDOH decided, well, I'm going to go ahead and create a policy because I can get it done. I know really what the restrictions are going to be. It ended up being 16 pages, very technical, a lot of examples, a lot of restrictions, just about on everything. I had piloted from September to December, being able to do everything except I knew don't put any PII, PHI, or restricted data into it because we didn't know at the time what was going to be tagged well, what would definitely be secure. But beyond that, we could pretty much just use it for anything we wanted to. When this came out and I read through the policy that our CIO had put together, I wasn't sure if I could touch Copilot again at the time. Really, there were so many restrictions that said don't use it for documents, for procedures, for policies, for frameworks, for anything that is going to be not state secrets, but something that's going to be specific to internal only. And we realized that nobody was going to touch it after reading that. So we started looking at it as through an MVG perspective, and realized that we could have the two-page or create a two-page policy with 7-page SOP. Really, the policy was focused on risks. We still can't put in data at this point, and so we feel a little bit more secure about it. But again, we had 2 weeks to get this out before they started rolling it out to the agency, and we wanted people in the agency to be able to use it. In fact, for those that don't know, minimum viable governance is something you can feed into Copilot fairly easily. Just say, hey, I've got this policy that's really long, really complicated. I want to strip it down a little bit. It's a good way to start with a draft and say, where can I start stripping? What's the most important risks that I have? So just as a spot for Copilot, use it for that if you need to, just to see what it would look like. Obviously, you need to check everything you need to go through, but it was good for us to start and look at what was it that we really needed to focus on. And then the SOP really helped them see, okay, how can I use it? It still be safe. So those are some of the big examples we have here. Okay, so now we kind of move into why MVG actually helped improve, and we're looking at Copilot specifically here. So it was lengthy and detailed. Like I said, 16 pages, very strict prohibitions, included extensive risks lists, examples, and explanations. It combined the policy, standards, and SOP all in one spot. And again, at an early stage, that would be fine, except we really wanted people to see this policy and the SOP and understand what can we do, because we wanted people to start using it. So again, we reduced the policy and SOP down and separated them out. We focused more on what you must or must not do. When it came to the SOP, it holds operational detail only. But then we really, we looked at it and say, okay, we've got all these risks, but there's no way to get around the risks when we first developed it. So we started saying, okay, what can we do to go around some of these risks? And we developed an exception process, and that was part of the governance process, was to figure out, well, can we never do it, or are there some instances where we can? We have data that's public data, so can we use that even though the policy says you can't? So we built into the policy these exceptions, an exception process. They can go to the chief information officer and say, we have data that's not on dashboard yet because we haven't built the dashboard, but but it is public information. It's not something that we need to hide. Can we put it in there? And then we'd put a business purpose. What is the reason that you feel AI is going to help you for this? So we document all that. We keep that stored somewhere. And that's what really helped us change here. Beyond Copilot, MVG has helped us simplify the data sharing policy, clarify standards, and reduce friction across the IDOH. Again, we have 40 different divisions inside of IDOH. And there's, between weights and measures and immunization and labs, there's so much variation in the type of work that they do. We wanted to build something that would work for everyone and not just restrict to a few different groups. And again, that's where that teamwork becomes important, of working with them. It's one of the big reasons that I enjoy this work I do, because I get to work with all of the divisions in the agency. And why it works better, I'll quickly go through these, but hopefully the slides will come out to you later too. Reduces friction and increases adoption by giving staff a policy they can read, use, and follow. Makes responsibilities clear by separating policies, the musts, and from procedures, the hows, so people know exactly where to look. Speeds up the updates. You can revise SOPs quickly without reopening or reapproving the entire policy. Supports innovation. Teams can move faster with defined minimum controls instead of navigating dense documentation. It improves consistency across the programs by applying the same lightweight risk-based structure used in other IDOH MVG efforts. And finally, it helps strengthen compliance. It focuses the controls, or focus controls are easier to train, audit, and enforce than sprawling documents. the things we really want you to take away is that minimum viable governance really helps enable your staff to do their work. It shouldn't restrict the work that they do outside of those main legal risks that are going to be important. Definitely work with your legal teams when you're building these out to say, is there something I'm missing? Is there a legal risk for only having this in my policy? Start small. If you have to start building everything in a single policy, if you have the time to do that, but then slowly move out to scaling it up into that minimum viable governance where you can separate those pieces out. And then finally, keep it simple. Don't overly make it complex because the staff won't read it. They'll get confused by it. They'll basically think to themselves, what can I do? What can't I do? And they don't want to, it's a lot in a single policy to have all that. That's really our presentation. If there are any questions specific to IDOH, I'm here for that. Chris is here for any statewide sort of ideas on minimum viable governance. So any discussion even? Yes. Yes, and it depended on which, in IDOH, it depended on what the policy was. One of the policies I'm working right now on our NIST has different families of policies. I'm working on the audit and accountability family right now. And with that, I need to work with both our privacy officer, but also our data engineering team and our tech team to say, okay, this is really what NIST is saying we should do. We need to format it in a way that you guys actually can do these things. We don't want to have the same restrictions because we don't have the same staffing as they would have, or the ability to do some of the same things. So so with that, I worked with them. When it came to the data sharing, I actually ended up talking with almost every one of the 40 program directors and their programs just to figure out what type of data requests are you getting right now, and then do you have restrictions set up? Do you have your own form? There were a lot of forms that there were a lot that had forms that I had to kind of develop into the centralized form because they had separate questions that were very specific to their program area. And we were able to build it in a system that could branch out those questions. So if the requester said, I want data from HIV, then they've got all these new questions that wouldn't exist if they said, I want immunization or something else. So yes, I do try to make sure and with Copilot, that one we didn't have a lot of time. So really it was working with the legal team, our data team, and our tech team to quickly kind of break apart that 16-page very technical document into something that the rest of the staff could understand. Yeah. Yes.
I would still start with breaking it up, and then going from each use case, setting the primary controls for each of those, and then possibly still combining it. Now that might make it a little bit longer than what you had hoped for, but if you have those really, this is where you have to kind of like draw that line. If you have like a lot of difficult use cases that require a lot of specifics, then yeah, it may end up being just a tad bit longer. But once you identify those key controls and what you have to prioritize as far as risks goes, then you'll be able to kind of cut that noise down as you keep going. And you can still like quarterly go back to the policy and say like, oh, well, this wasn't working correctly. We need to add like this under this policy as well. Does that help? Okay.
Just to add to that, when I'm working on I'm going to use our AU policy again as an example. When it was first put together by IDOH, we had a consulting group come in and kind of pull all the NIST, the ones that we really wanted to focus on. And what they came out with was, I think there are like AU01, AU02, all the way down to AU16. They pulled out 15 policies and created 15 policies specifically for AU because each thing was a little bit different. By using minimum viable governance, I was able to break it down into a single policy that was just a couple pages, but there were 7 different SOPs that came out of that because there's so much separation. So the policy still should be a single document that's really just a few pages that the focus is those risks, those controls that say, hey, these legally need to be done. Beyond that, that's where you can break out the standard operating procedures to say, okay, this section of standard operating procedure or this standard operating procedure is for this specific use case. It should be done this way. This SOP should be done that way. Does that help a little bit better too? Okay, good. Yes. I'll start. We're just starting. I mean, we've had a few policies that we've gone through and been approved using this. And I will say legal loves it, honestly, mostly because they see a 30-page policy as well, and they think that's a lot for a policy. They do want to make sure that they're a part of every discussion on policies because those risks, with a 30-page policy, you can see a whole bunch of risks, but some of those you can pull out: automation, exceptions, exemptions, things like that. But they still want to be a big piece of that, so we make sure that they are. We have a privacy and security subcommittee that reviews all of the policies that we do related to anything around privacy and security. So yes, I think that's for them. They like it. As for the highest level exec, I think they're starting to learn to understand the difference. We haven't heard pushback yet. We've had a lot of questions, and once we kind of go through it with them, that helps a lot.
Well, John, I'd say I'm safe to say that it's quite the contrary. If I were to write out a 30-page policy, it'd be sent right back to me and be like, no, make this shorter. Yeah, which I've done that. Yeah. The most recent one, just to kind of give an example. I'm going back through and redoing our cloud contracting terms through the CDMC lens, through the EDMA Association. A really long acronym. It's the Cloud Data Management Capability Framework. It's actually slightly adjacent to DCAM, where DCAM is more of the on-prem and everything, policies and such, and then the cloud framework is whenever you reach into that hybrid state. But I digress. Trying to get our current cloud contracting terms aligned with CDMC. It was a 13-page policy to begin with, and then once I started going through and adding all this, it turned into 43 pages. And so now, which of course, do you think that's acceptable? And so now I'm actually going back and applying MVG to it to cut out a lot of it and try and point out perhaps some automations that we can account for as well. Yeah.
Multiple things that are, oh, that may benefit, that may benefit. Wanting to walk through that, is that I and maybe a team of my agency wanted to walk through time. Are you guys that resources? Or do you have resources?
I haven't seen a lot of. I haven't seen a lot of resources specifically to this yet. I know there are a few things out there. Legal is going to be your biggest resource. We definitely can help point you out, or look through some things, help point some directions for you, just because we've both been doing it a little bit now. But the big thing is focus on those risks, making sure that they're in there, making sure that the right individuals that are part of who's going to be doing that, like the players, are added to the policy as well. Don't put people's names individually, put positions, because names will change and you don't want to have to change a policy every time somebody changes positions. But our agency privacy officer is listed in a lot of our policies, our chief information officer. We just don't make sure their names aren't in there. But outside the players and the risks and the basic structure of what you want done, that's all the policy really should be. So focusing on that and seeing, is there something that, like you said, that we can automate? Is there something that we can create an exception as well for some of the things? with our health data, because there's so many restrictions on a lot of the data, we really try to make sure that we have that exception through the data sharing agreements, the legal documents that could then come out of it. But yeah, certainly reach out to Chris or I. My email's here at mastucky@health.in.gov, but we're always available. And Chris, his agency is available for the entire state, so use them. I'm just available because I am willing to help.
The first time I found this framework was actually whenever we started up a lot of our AI governance stuff. Now, I'm not endorsing them. I have no contact with them, but the first company that I actually stumbled upon that used this was a company called ModelOp. And they have, I think it's a couple of pages that actually kind of goes through and defines a lot of the key points of MVG. So if you, there are quite a few companies that have like their own documentation on it. So if you want to start looking it up now or next week, whenever, there's going to be documentation out there for it. So. All right. Well, thank you guys. We really appreciate it.